So welcome to this video, and on this video I want to talk a little bit about blood groups, blood types, and they help us to understand the basis behind blood transfusions as well. So why don't we just make a start right away? So let's talk about blood transfusions, and here I have something to get us started with thinking about the background behind these. So blood transfusions are often used to manage patients who have experienced substantial loss of blood. So the consequences of losing a large quantity of blood can be significant. Let's say, for example, a loss of 15 to 30% causes weakness, whereas loss of over 30% causes shock, which can be fatal. And there are also some other reasons why we may turn to blood transfusions. To understand how blood transfusions work, we need to spend time talking about blood groups. And that's really going to be the focus of this video. So there are so many misconceptions about blood groups. Some believe that you can be healthier if you eat right based on your blood group. And some believe that your personality is defined based on your blood group. And I've even heard of some who believe that you can find a perfect partner based on your blood group. I think that one of the reasons why we have all these misconceptions is that in the past, historically, one had to get a blood test to get a marriage license. So this has nothing to do with being a good match, but it was really preventing spreading of blood-borne diseases. And one of the reasons why I think that so many people often get confused about blood groups is that there are many different types of blood groups and many different ways of classifying blood groups. The most important ones are our ABO blood grouping, which we'll focus on this video. And then we also have Rhesus blood grouping or Rhesus factor blood grouping. We'll briefly touch upon that. We won't go into too much of a detail when it comes to that. Often I see that both ABO and Rhesus factor blood grouping are presented together, but there really are two different grouping systems. And interestingly, we share our ABO and Rhesus factor blood groups, which are closest evolutionary relatives, so apes, chimpanzees, and gorillas. And often when I teach this topic to my students, they are eager to memorize these donor-recipient tables, as these tables allow us to check donor and recipient match. However, for you, there is no need to memorize this table. We will work through the process so that you can prepare your own version of it. But before we do that, let's look at a little bit of a history. So blood groups were discovered in 1900 by Karl Landesteiner. And he was a clinician, and what he wondered was that sometimes when he gave blood transfusion, it saved the patient's life. And notice that at this time, this was direct from donor to patient transfusion with nothing in between these two individuals. But other thing that Karl also noticed was that sometimes some patients died as a direct result of such transfusions. So they could be highly beneficial or they could be lethal. And he was very curious why this might be the case. And in fact, this work earned him a Nobel Prize in 1930. So blood groups are a genetic trait, and just like any other genetic traits such as eye color, your hairline pattern, all of these things, it is inherited from parents. Which again makes me think of this concept of dating based on your blood types. It absolutely makes no sense whatsoever. It makes just as little sense as an idea that you can find a perfect partner based on your earlobe, whether it's attached or non-attached. And of course, that makes no sense whatsoever. So one of the reasons why I think that my students often find ABO blood groups confusing is that they are not inherited based on Mendelian fashion. Instead, it gets more complex because we have three alleles that we need to pay attention to. So we're going to use an analog in this video, and this might feel initially like a little bit of a stretch, but bear with me. So red blood cells had these biconcave disc shapes. So in a way, we can think of them as donuts. They look alike, just they don't have this hole in the middle that donuts would. And what we will be focusing is not actually the donuts themselves, but what's on their surface. And in our analog, there are 4 types of donuts in this world. So some people have A sprinkles on the surface of their donuts. Some have B sprinkles. And some people are greedy and like to have both A and B sprinkles. And finally, we have some who have no sprinkles at all on the surface of their donuts. And these are what gives rise to the ABO phenotypes that we end up observing. So in our analog, these sprinkles that I've been using is actually going to be our antigens that we find on the surface of the red blood cells. So on the surface of the red blood cells, some people have A antigens. They are blood type A. Some people have B antigens. They are blood type B. Some people have both A and B antigens, so they're going to be blood type that's known as AB. And some people have no antigens at all. So these are our plain old donuts. They are our blood type O. And this sometimes confuses my students as they think that there are O sprinkles or O antigens, and there are not. In fact, many other countries use a convention where we call this blood type as blood type 0, since there's nothing there when it comes to the antigens. But in the US, it has become a convention to use the term blood type O. And alleles of the ABO system are located at the long arm of chromosome 9. And remember, this is unlike Mendelian inheritance. Instead of 2, we are going to see 3 alleles that we need to pay attention to. And let's look at that in more detail. So we can have lowercase I allele, which would code for plain donuts. We can also have an uppercase I with a superscript A. This codes for donuts with A sprinkles, so antigen A on the surface of those red blood cells. We also can have an allele, which is uppercase I, with a superscript B. And this in turn codes for donuts with B sprinkles, so B antigens on the surface of these red blood cells. So remember, you inherit 2 alleles, one from each of your parents, and we have these 3 allele options for each parent. So from these, because you inherit 2, we can actually make 4 blood groups. So let's see how this works. So if individual is blood group A, they are going to have A sprinkles, so A antigens on the surface of their red blood cells. And there's 2 ways how you can get to become blood type A. First way is that you get an allele for A blood type from both of your parents. The second way how you could become blood type A is that you received allele for A blood type from one of your parents, while the other one gave you the allele for the plain donuts. Now, if you're blood type B, you're going to have B sprinkles on top of your red blood cells, so B antigens located there. And there's 2 ways how you can get this as well. So you get an allele for B blood group from both of your parents, or you get an allele for B blood group from one of your parents, while the other one gives you the kind of recipe or allele for plain donuts. Now, if you're blood type AB, in this case, you would have A and B sprinkles. So on the surface of your red blood cells, you would have both A and B antigens. To become an individual whose blood group is AB, there's only one way how that can happen. You must inherit A from one of your parents and B from another of your parents. And finally, if you're blood type O, this means that you don't have any sprinkles, so no antigens for the ones that we're looking at now on top of your or on the surface of your red blood cells. So to become blood type O, both of your parents must give you the recipe for be getting plain donuts. And this is really why we see that it's more rare to be blood group O or more rare to be blood group AB than it is to be A or B. So, to understand blood transfusions, we must talk about antibodies and antigens. And let's start with antigens. So antigens are these A and B sprinkles on the surface of the red blood cells that we've been looking at. Antigens basically help us to identify cells with each other. And you're going to have self-antigens. These self-antigens tell your body that this cell that's showing these, expressing these antigens, that this cell is part of you. And if we end up finding a foreign antigen on the cell surface, that's a sign for us that there's a stranger now present. Your body is designed to recognize and remove any cells with antigens that are not yours. And if you have never seen an antibody before, here it is. So antibodies are responsible for recognizing these strangers and dealing with them in your body. So if you are exposed to antigens that are foreign, you will make antibodies against them. And this will cause a reaction to happen where red blood cells start to clump together. So let's look at this together. So here we see at the very top of the screen a normal blood smear. A drop of blood has been spread across the microscopic slide and then stained. You'll notice how all of the red blood cells, those round structures, they're nicely and evenly spread apart. At the bottom of the screen, you will see what happens when we have incompatible antigens on the surface of the red blood cells, and they're being detected by antibodies. So this causes this clumping together to happen for these red blood cells. This is known as our agglutination reaction. So now this brings us back to this donor-recipient table, and let's see if we can make sense of it, what's going on. We're going to focus still on just ABO blood group. We'll leave that Rhesus factor till a little later. So let's go through this version that we prepared here on this slide. So let's unbundle it again. If one is blood type A, they are going to have A antigens on the surface of their red blood cells. So if you have antigens for something, you will have antibodies for whatever you don't naturally have antigens on the surface of your red blood cells. So this individual will have antibodies against foreign B antigens. So if we mix blood of an individual whose blood group is A with blood of a donor whose blood group is A, that's going to be okay because it's the same type of blood that we're giving to them than what's their normal own blood. On the second scenario, we're seeing that we cannot mix blood for an individual whose blood group is A with a donor whose blood group is B, because the B antibodies will attack the B antigens on the surface of the foreign red blood cells. So this agglutination reaction will happen. Now, mixing blood of an individual whose blood group is A with donor whose blood group is AB, this is also going to be problematic and agglutination happens. And this is because the B antigens on the surface of the foreign red blood cells are attacked by anti-B antibodies of that individual who would be the recipient. And finally, we're seeing what happens if we're mixing blood of an individual whose blood type is A with a donor whose blood type is O. This is going to be okay because the anti-B antibodies have nothing to attack on the surface of these foreign red blood cells. So what we have done, we have just covered the first row of this diagram. Let's have a look at the second row. So if individual's blood type is B, it's going to follow the same pattern, just with different targets. So anti-A antibodies will attack any foreign red blood cells that have A antigens on their surface. So that would be donor blood for blood group A and donor blood for blood group AB. Others would be okay. Now let's have a look at an individual whose blood group is AB. This individual is going to have both A and B antigens on the surface of their own red blood cells naturally, so there's no antibodies for these in their own blood. So they can receive blood from all donors. Now, if individual's blood type is O, they will have anti-A and anti-B antibodies in their blood. So they will attack any foreign red blood cells except their own kind. So I guess that if you're trying to extract a big take-home message from this diagram, it would be that all you need to remember is that you cannot give foreign antigens to someone. And therefore, what we end up seeing is that type AB is universal recipient. You cannot give them anything that they don't already have. And type O is universal donor. They are these plain donuts. They don't excite anyone's immune system. We are familiar with ABO blood groups. Let's look at the Rhesus factors briefly. And there are 25 different Rhesus agglutinogens, so 25 different Rh factors. The most common ones that we see are C, D, and E. And if someone is Rhesus positive, they will have presence of D antigen on the surface of their red blood cells. And this actually is 85% of Americans who fall under this group. Now, this is where the issues might come if the mismatch of an Rh negative mother carrying an Rh positive baby causes problems for the unborn child. And normally this is not an issue during the first pregnancy. This usually proceeds without problems. The challenge is that during the delivery, the bloods of the child and the mother mix, and the immune system is now sensitized after this first pregnancy. So the issues arise during the second pregnancy when the mother's immune system produces antibodies to attack the Rh positive blood, and we see hemolytic disease of the newborn. And if you're interested about the consequences of the hemolytic disease of the newborn, I have some supplementary videos for you available, and I'll link them to the end of this video so you can pull them up from there. So this really brings us to the end of all of the material that I wanted to cover when it comes to the blood chapter. We've certainly covered a lot of ground, and I appreciate you sticking around with me. Until next chapter, thank you, and I'll see you there.